Hello everybody, my name is Venya and I am a first year medical student at the University of Nottingham. In this video, we're going to go over how I secured all my medical school offers and how you can secure your spot too. At the beginning, we're going to quickly brush over all the prerequisites and then we can delve into my top tips. There's also timestamps in the video description below, so feel free to skip to whichever section you desire. So the first thing we're going to talk about is your GCSEs. Yes, your GCSEs do matter because that is the first thing that universities look at. Some universities tend to place more emphasis on the academic side and hence they consider it more, and some place less emphasis on it and more so on UCAT. But as a general rule of thumb, what you want to do is that you want to look at the number of GCSEs you have. For example, if you have 7 GCSEs, 8 GCSEs, 9 or 10, you also want to look at the grades you achieved in your core subjects, which are English and maths. Most universities require roughly about 8 to 9 GCSEs and at least a grade 6 or a 7 in English and maths. You want to take the information and you want to cross-check with the individual universities you are applying to. And if your university is more academic heavy and if you have good GCSEs, you might want to consider applying to that specific university. However, if you don't, you might want to consider applying to a more UCAT heavy university if your UCAT scores are particularly higher. The next thing to take into consideration in terms of academics is your A-level predicted grades. You want to maximize predictions that you have gotten, and they should be at least AAA because that is the minimum entry requirement. Also, universities tend to place importance at chemistry. Most medical schools do not accept applicants without chemistry, and the best way, in my opinion, to get the best possible predicted grades is to do very, very well in your AS mocks, so take year 12 seriously. The next thing you might want to do a year or 2 years earlier is try to find as much work experience as you possibly can. The best way to do it is to contact your local hospitals and your local GP surgeries and try to shadow different doctors in different specialities. Also, you should try and shadow people like nurses, like healthcare assistants, physicians associates, because they're also a part of the wider multidisciplinary team. And medical schools tend to ask you questions like, why do you want to be a doctor? Why don't you want to be a nurse? When in fact they employ similar qualities such as, an interest in science, an interest in helping people. So you want to be able to identify the nuances in these jobs, and you want to try and show a realistic appreciation for what the career entails. So if you're concerned about not being able to find work experience, you can also get virtual work experience. You can get it via Brighton Sussex Medical School, Observe GP, or any site that you come across. Medical schools generally tend to recognise that and make sure to include it in your UCAS and personal statement. In addition to work experience, I always recommend people to get some sort of volunteering, whether it be tutoring someone, St. John's Ambulance, working at a charity shop, volunteering at a care home. It's always good to have those soft skills developed on the side, and doing it long term will help you show commitment to it. This is what medical schools want. They want someone that is committed. So make sure you pick out some sort of work experience, whether it be in person or virtual. You pick out some sort of volunteering activity that you have done and make sure you stick to it and try your best to do them long term. This will not only help you out to determine whether medicine is a career that you want, whether you're ready for that long commitment, whether you're ready for those long hours, but it would also help you loads in your personal statement and in your interviews. Now you've got so much work experience and volunteering under your belt. What do you do about it? make sure you write every single thing down that you do towards your medical school application. Create a Word document. Write down what you saw when you shadowed that doctor. Write down what you did in your volunteering. Write down any skills that you saw the doctor show and how the doctor handled the patient. Write down anything that you did in a situation when you were volunteering to make that situation better. For example, let's say you went shadowing and the doctor is breaking bad news to a patient. The patient is hysterical and your doctor calms the patient down. Now, there's so much to unpack over here, but the main focus of your writing it down should be what happened in that scenario, how the doctor behaved, what skills the doctor demonstrated. Do you think you have those skills? And if not, how can you develop those skills? And ultimately ask yourself, do I want to be in that doctor's position 5 years, 6 years, 7 years down the line? Do I want to be the one consoling that patient? Do I want to be the one breaking this bad news? You can take this, scenario and you can apply it to multiple other scenarios. And this is how you should be going on about it. Now you've come to the most dreaded part of the application, the UCAT. All I can say about UCAT is that the more you practice, the better your results will be. Yes, it's a test that can be practiced for, so practice, practice, practice. The platforms that you can use are Medify and Medentry to look at questions. You can also perhaps do the Kaplan textbook just to get a feel of how the UCAT exam's like. You can also get tutors on websites such as MedicMind, and there's loads of YouTube videos out there detailing the tips and tricks on how to do well in the UCAT exam. Okay, so this is it now for the prerequisites. All you require is your grades, which includes your GCSEs and A-level predicted, and hopefully when you get an offer, an AAA, you would require your work experience, you would require UCAT, you would require a personal statement and an application that needs to be submitted before the 15th of October. If you're an international student, you might also require English language tests such as IELTS. You might also want to look at your age before submitting that hit button and choosing those universities, because sometimes if you are not 18 years old, universities tend to reject applicants if it is not in their policy. Moving on to my best tips. The first tip and the most important tip I will tell you is to apply strategically. You want to select a medical school that would give you the highest chance of getting an interview. Okay, some people have their strengths lie at the academic side of things. So they have very good GCSEs, they're very good AS results, they're very good A-level predicted grades, and some people, their strengths lie in UCAT. So, they have really, really high UCAT. Most people are either one or the other, but if you are a mix, that is brilliant, which means, you're unlocking so many more universities. But if you are better at academics, then you might want to apply to universities that focus more heavily on the academic side of things. However, if you are very good at the UCAT, you want to apply at universities that focus more on the UCAT side of things. The best way to research is to do your own. Do not rely on other people to do your research. However, places that you can do your research is go to university websites. You can read about the requirements. You can email universities. You can also go onto websites such as the student room. You can ask people, if they have any recommendations for you. And you can also look at people's profiles, people from previous years, if they have similar UCATs to you, if they have similar GCSE results to you, where they have applied and whether they've gotten an offer or not. You can also look onto Reddit, but make sure whatever advice you get, whatever you get at the end of the day, make sure that you do your own research. You look into it thoroughly before hitting that submit button. Another thing I would tell you in regards to this is that find a way to strike a balance between choosing a medical school that you want to live in for the next 5 years and choosing a medical school that would give you the best chance of an interview. For example, let's say you want to live in Liverpool. You love living in Liverpool, your friends there, and you've lived there your entire life and you want to go to medical school there, but you are not 18 yet. You will be turning 18 the following year. Liverpool does not accept applicants that are not 18. Your application will get rejected. So why waste a spot? Find a university where you will enjoy spending the next 5 years, because let's be honest, it is a long time. And also where you will maximize your chances of getting into the career that you have dreamt of. My next best step relates to interviews. Try your best to practice as much as you can for these interviews. What you want to do at the very least is at least find a Word document and make a list of all the commonly asked questions for your course, which is medicine, and for that specific university. So things like, why do you want to do medicine? What attracts you to medicine? What skills do you have that would make you a good doctor? What disadvantages do you think a career in medicine can entail? Why do you want to go to a medical school? Find a list of general questions and write down your answers referencing your work experience. So this is the best way to go about interviews. Try to make a Word document, learn all the things that you've written down for the basic questions. Maybe if you can, try to practice different types of interview questions, and try to practice with a friend, with your teacher, with a parent, maybe even with a pet. You want to be speaking out loud, because that is what you're going to be doing in an actual interview scenario. There's also loads of YouTube videos out there that you can watch to make sure that your interview speaking skills are on point and what you are saying is accurate. In addition to that, the last thing that I would say about interviews is carry yourself with confidence. Even if you say a sentence and it's not, let's say, grammatically correct, it is not what you wanted to say and you don't know what you're talking about. But if you say that sentence with confidence, right, it's going to make a whole world of difference. Even when you know what you're talking about, but you're shy, you're timid, you're jumbling up your words, that will not show well to your interviews. So let's use an example. Let's say you have gone into a doctor's office and you are afraid, you're anxious, you don't know what's happening with you, and the doctor is making a diagnosis, but they're very afraid themselves, they're very nervous, they're jumbling up their words when they're talking to you. You will not have confidence in that doctor. You will lose your faith in that doctor. This is what interviewers want in students. They want students that are confident in stressful situations, because you don't want a doctor that is anxious and nervous when they're talking to you. Similarly, medical school interviewers are looking for students that do not get very anxious and nervous in stressful situations, for example, like interviews. My last tip is about waiting. After you've done your interviews, after you've done your whole application, make sure when you're waiting, you are not neglecting your A-levels because you're anxious about the results. Do not be doom scrolling into the student room. Do not be doom scrolling on Reddit, asking your friends every single day. Make sure you're also focusing on A-levels, because all that effort you've put in is going to be futile if you have not gotten an AAA on your results day. In addition, I would like to say, have faith in yourself. Don't lose out on your self-esteem in this journey. Your worth is not determined by you securing a place in medical school. You can always try again next year. You can always try again when you have more maturity, when you worked in your application and with more vigor. Have some self-esteem, have self-confidence, and do not associate your worth with this. Keep working hard, keep trying your best, and well done on reading so far in the video, and good luck with your medical school application. I'm sure you will do amazing if you try your best.